Your liver performs its heaviest workload while you are fast asleep, though most people remain completely unaware of this fact. Starting around 10 o'clock at night, the organ responsible for filtering your blood, metabolizing medications, and determining whether dietary fats are stored or burned shifts into nighttime repair mode. Consequently, whatever food you consume during that final hour before bed either assists this critical repair process or burdens your liver with additional work it cannot finish before morning. After age 60, this metabolic function becomes far more important than you might imagine. Currently, nearly 1 in 3 adults is walking around with excess fat accumulated inside their liver tissue. Most of them feel entirely healthy because a struggling liver causes no physical pain, lacking internal pain receptors to send warning signals. By the time liver dysfunction appears on routine blood work, underlying tissue stress has usually been silently developing for years. Over my 15 years in medical practice, I've watched this silent issue quietly progress into serious disease. That is why tonight, I am sharing the specific evening fruits that actively help your liver mobilize and clear stored fat while you sleep. A few of these choices will seem familiar, several will genuinely surprise you, and one is a specific fruit most adults over 60 are routinely warned to avoid. At the very end of this video, I will share a simple bedtime recipe that combines the best of these ingredients into a single glass. Before revealing our first fruit, I want to reassure anyone watching who worries they have waited too long to address their liver health. You have not left it too late. In my practice, I have seen individuals in their 70s completely reverse a fatty liver because the liver remains one of the few organs capable of true self-regeneration once you remove metabolic overload and provide essential nutrients. That is precisely why I produce these videos. I want you living a longer, stronger, healthier life well beyond the age society expects you to slow down. That's why I compiled my clinical recommendations, timing strategies, and high-impact daily habits into a clear, comprehensive guide that has already helped thousands of seniors restore their energy and lab numbers. If you're interested, the link is right on your screen whenever you wish to explore it. Now, let's look closer at how your liver operates. Here is what brief doctor visits rarely take the time to explain. Your liver is the busiest biochemical factory in your body, and it performs its most critical tasks on the night shift. While you sleep and remain in a fasting state, your liver handles heavy metabolic demands, pulling fat out of storage to burn as fuel, processing and packaging cellular waste for elimination, and repairing daily tissue wear and tear. This overnight fasting window, stretching from your last bite at night to your first bite the next morning, is designed as a deep cleaning period for your liver. The primary problem arises from what we consume right before that fasting window begins. When your final snack of the evening consists of ice cream, crackers, or fruit juice, you flood the liver with rapid sugars and fats right as it prepares to initiate repair. Instead of burning internal fat overnight, the liver is forced to spend those hours storing new calories away. Repeated over years, excess fat accumulates inside hepatic cells, a condition known medically as hepatic steatosis, which simply means fat residing where it shouldn't. Left unaddressed, this fat triggers chronic liver inflammation, which gradually develops into irreversible tissue scarring. This brings us to why timing is the essential factor that few experts mention. It is not merely what you consume, but when you consume it. A fatty liver almost never causes early symptoms, progressing silently through distinct phases. First, microscopic fat builds up within the cells. Next, that accumulated fat triggers inflammation, a stage called steatohepatitis, which essentially means a fat-laden liver that has caught fire. Over time, that low-grade inflammatory fire lays down dense scar tissue, which cannot be reversed once established. The crucial window for reversing this process is during the early stages, where most people currently reside without realizing it. Your evening routine represents a daily opportunity to utilize that window effectively rather than wasting it. Every fruit on tonight's list fulfills one of 3 targeted functions during that overnight fasting period. delivering potent antioxidants that neutralize cellular stress from processing fat, supplying soluble fiber that nourishes gut bacteria and reduces the toxin load traveling to the liver, or providing specific botanical compounds that flip your liver's metabolic switch from fat storage back to fat burning. Furthermore, every option is low enough in natural sugars that you can enjoy it at night without spiking nighttime insulin levels right before sleep. Let's examine our very first option. The first fruit is the kiwi, which earns its spot on a bedtime menu better than almost any other fruit available. Most people view kiwis merely as tart green fruits packed with vitamin C. While a single kiwi does satisfy most of your daily vitamin C requirement, which is critical because your liver rapidly consumes antioxidants overnight while processing fat, the real reason I prescribe kiwis specifically in the evening relates to sleep quality. Kiwis are among the rare whole foods naturally rich in serotonin, the key neurotransmitter your brain relies on to wind down. In a clinical trial at Taipei Medical University, researchers instructed participants to consume 2 kiwis 1 hour before bedtime. Within just a few weeks, subjects fell asleep significantly faster and achieved longer, uninterrupted sleep. This is vital because your liver performs its deepest cellular repair work during restorative sleep stages. A fruit that improves sleep depth actively protects your liver throughout the night. Beyond enhancing sleep, kiwis provide rich amounts of soluble fiber and specialized polyphenols, natural antioxidants that quiet the low-grade inflammation driving hepatic fat accumulation. To implement this strategy, enjoy 1 or 2 whole kiwis roughly 1 hour before bed. Try to consume the skin as well if possible, as it contains a dense concentration of fiber and protective antioxidants. Simply give it a thorough rinse and rub to make the light fuzz unnoticeable. Second on our list is blueberries, which carry some of the strongest direct clinical evidence for supporting liver tissue health. The deep blue color of blueberries comes from specialized pigments called anthocyanins, which represent some of the most potent liver protective compounds found in nature. In clinical studies, concentrated anthocyanins effectively lowered elevated liver enzymes like ALT and AST, the key blood markers that rise when liver cells suffer inflammatory stress and damage. Anthocyanins in blueberries accomplish 2 vital tasks simultaneously. They cool active inflammation inside hepatic tissue while slowing the liver's internal mechanisms for creating and storing new fat. Skipping blueberries because they feel like an indulgence means missing out on one of the most accessible forms of liver protection available in your local market. Frozen blueberries are just as effective as fresh ones, often picked at peak ripeness when pigment concentration is highest. Here is how to incorporate them at night. Consume a modest portion of about half a cup, enjoyed plain or stirred into unsweetened yogurt. Keeping the portion small is essential, because even though blueberry sugars are low and bound in fiber, you want to avoid heavy late-night carbohydrate loads. Half a cup supplies your liver with dense, protective pigments without overloading your system with sugar. Third on our countdown is an option that surprises many people because they don't even classify it as a fruit: the avocado. Botanically, the avocado is indeed a fruit, and for your liver, it stands as one of the most beneficial choices on this list. Many individuals avoid avocados due to fear of dietary fat, but that fear is misplaced. The fat content in an avocado consists primarily of monounsaturated fatty acids, the same heart-healthy fats found in extra virgin olive oil, making it exceptionally liver-friendly by helping pull fat out of liver cells rather than depositing it. Additionally, avocados offer a unique benefit unmatched by other fruits. They are exceptionally rich in glutathione, the master antioxidant your liver depends on to detoxify harmful compounds passing through your bloodstream. While your liver synthesizes its own glutathione, production declines naturally with age, and a fat-burdened liver consumes glutathione rapidly. Eating a fruit that supplies pre-formed glutathione and its biochemical precursors offers direct structural support to your liver's overnight filtration system. Furthermore, a single avocado provides roughly 10 grams of dietary fiber, which slows digestion and supports gut health. Consuming a quarter to a half of an avocado in the evening is an ideal portion. Enjoy it mashed with a pinch of sea salt and lemon juice, or sliced over a small piece of whole grain toast 2 hours before bed. It provides lasting satiety, effectively preventing late-night snack cravings that sabotage liver health. So far, every fruit discussed performs the same vital tasks, neutralizing oxidative stress and reducing fat accumulation. But the remaining choices offer even more specialized benefits, including the one fruit your physician may have advised you to avoid. Before we continue, if this video is providing clear explanations for why your liver requires nighttime support, please tap the subscribe button and give this video a quick like. If you have family members managing weight or blood sugar challenges, consider sharing this with them, as liver health sits at the core of both issues. Moving to number 4, we have red grapes, where the deep color provides the primary therapeutic value. The skins of red and purple grapes are densely packed with resveratrol, a specialized plant polyphenol that has become one of the most thoroughly researched molecules in longevity and hepatology studies. Resveratrol supports liver health by stimulating key cellular pathways that prompt your cells to burn fat for energy rather than storing it away. It also dampens liver inflammation and shields hepatic cells from the oxidative stress generated during overnight fat metabolism. Green grapes lack these high concentrations of resveratrol, so always select deep red or purple varieties. To keep this recommendation balanced, remember that grapes contain higher natural sugar levels than other options on our list, making portion control vital. This is not a fruit to consume in large bowls late at night. 10 to 15 red grapes represent the ideal evening serving. Consume them whole, with the skin intact, as that is where the resveratrol resides. A helpful tip is to freeze them beforehand, as frozen grapes take longer to chew and satisfy dessert cravings without resorting to sugary treats. Number 5 is the humble apple, which supports liver function through an indirect pathway many people overlook: your gut microbiome. Apples represent one of the richest whole food sources of soluble fiber in the form of pectin. When pectin reaches your lower digestive tract, it feeds beneficial gut bacteria, prompting them to produce short-chain fatty acids that signal the liver to reduce inflammation and store less fat. This physiological connection between your gut and liver operates directly through the portal vein, meaning a healthy gut environment sends protective signals directly to your liver, whereas an imbalanced gut floods it with inflammatory compounds. The apple quietly strengthens the gut side of that pathway. Furthermore, apple skins contain quercetin, a powerful antioxidant proven to diminish hepatic fat accumulation and inflammation. Peeling your apple discards most of these protective compounds, so always eat the skin. Enjoying a medium, slightly tart apple, such as a Granny Smith, in the evening is ideal, as tart varieties contain less sugar and higher fiber levels. For an added benefit, slice the apple and sprinkle it with pure Ceylon cinnamon, which offers gentle support for healthy blood sugar management. Consume it an hour or two before sleep to allow the fiber time to work. Number 6 on our list is pomegranate, a fruit rarely consumed in the evening due to its reputation for being tedious to prepare. However, the extra effort yields immense metabolic benefits. The vibrant red arils contain punicalagins, extremely potent antioxidants that exceed the antioxidant capacity of green tea or red wine ounce for ounce. For your liver, this concentrated antioxidant power directly targets underlying tissue stress. A fatty liver operates under severe oxidative stress, that internal cellular rusting mentioned earlier, and pomegranate supplies the exact compounds needed to quench that damaging reaction. Clinical research confirms that pomegranate consumption helps reduce hepatic fat levels and quiet persistent liver inflammation. Pomegranate also actively influences circulating blood fats, helping your body process triglycerides, the exact fats that overburden an exhausted liver, while enhancing your liver's ability to clear them efficiently instead of storing them away. For a fruit that offers a sweet taste, it delivers serious metabolic support overnight. A quick buying note: choose whole pomegranate seeds rather than processed, bottled juices, which strip out beneficial fiber and concentrate sugars into a high-calorie liquid. If using juice, choose a small splash of pure, unsweetened pomegranate juice rather than commercial fruit blends. In the evening, a quarter to half a cup of fresh pomegranate arils provides the ideal dose. Enjoy them plain or sprinkled over unsweetened Greek yogurt. To seed a pomegranate cleanly, halve the fruit and tap the back firmly with a wooden spoon over a bowl, allowing the seeds to drop out easily. That tart sweetness satisfies evening cravings, helping you avoid foods that harm liver function overnight. Number 7 is papaya, a tropical fruit rarely utilized for liver support in Western countries. Papaya contains a natural digestive enzyme called papain, which assists in breaking down dietary proteins and easing overall digestive strain, while supplying rich amounts of beta-carotene and vitamin C. In regions where papaya is native, both the fruit and its seeds have been utilized in traditional liver tonic remedies for generations, a practice now supported by modern research. The antioxidants in papaya help protect liver cells against the cellular damage that drives fat storage and early tissue scarring. Furthermore, papaya is gentle on digestion and low in glycemic impact, making it an excellent late-night option. A sluggish digestive system at bedtime increases metabolic strain on the liver, and papaya promotes smooth nighttime digestion. Aim for 1 cup of fresh cubed papaya in the evening, enhanced with a fresh squeeze of lime juice for flavor and additional vitamin C. If fresh papaya is difficult to source locally, ripe papayas store well and are worth requesting from your local produce manager. Number 8 brings us to the surprising option mentioned earlier, grapefruit. This is the specific fruit many adults over 60 are instructed to avoid completely. Let's explore both sides of this clinical topic, as safety is paramount. Grapefruit stands as one of the most effective fruits for targeting a fatty liver. It contains high levels of naringin, a bioflavonoid antioxidant responsible for grapefruit's characteristic bitter note. Research demonstrates that naringin stimulates the liver to burn fat, energy, reduces fat storage within liver cells, and combats the inflammatory processes that drive tissue scarring. Ounce for ounce, few fruits offer greater therapeutic value for liver health. Why are seniors frequently warned against consuming it? Grapefruit contains natural compounds that inhibit a key digestive enzyme in the gut called CYP3A4, which is responsible for metabolizing many common medications. When this enzyme is blocked, certain prescription drugs can accumulate in the bloodstream to higher concentrations than intended, which is particularly relevant for specific cholesterol statins, blood pressure treatments, and other routine prescriptions. Therefore, I must be completely transparent. If you take any daily prescription medications, do not add grapefruit to your diet without first consulting your physician or pharmacist regarding potential interactions with your specific medication profile. For many individuals, it is entirely safe. For others, it is contraindicated, and only your medical team can make that determination. If you receive clearance, enjoying half a grapefruit or a few fresh segments in the evening offers exceptional liver support, and the light dash of cinnamon can balance its tartness without added sugar. Before sharing our bedtime recipe, I want to establish an important medical distinction. These fruits provide dietary support for a liver that is fatty, sluggish, or stressed, but they do not replace medical treatment for advanced liver pathology. If you develop yellowing of the skin or eyes, jaundice, seek immediate medical evaluation. Likewise, if you experience persistent pain or swelling in the upper right abdomen, unusually dark urine, or sudden fluid retention in your legs and belly, consult a healthcare provider promptly, as these indicate serious medical issues requiring clinical care. Furthermore, if you manage diagnosed liver disease, hepatitis, or take multiple prescriptions, consult your doctor before making significant dietary changes, especially regarding grapefruit. Proper nutrition forms a strong foundation, but it works alongside proper medical care. Consider a patient I'll call Patricia, a 64-year-old retiree who presented with persistent fatigue despite feeling otherwise healthy. Her routine lab work revealed elevated ALT liver enzymes, and an ultrasound confirmed moderate hepatic steatosis. She was shocked by the diagnosis, as she consumed virtually no alcohol and believed liver disease only affected heavy drinkers. Rather than initiating pharmaceutical interventions immediately, we focused on her evening dietary habits. Patricia routinely unwound at night with cereal or baked goods right before bed, precisely when her liver was scheduled to begin its overnight repair shift. We replaced those high-sugar snacks with targeted options: kiwi paired with blueberries on some nights, half an avocado on whole grain toast on others, or sliced apples with cinnamon. On weekends, she enjoyed fresh grapefruit after her pharmacist verified it didn't interact with her blood pressure medication, and she incorporated a 10-minute walk after dinner. Within 3 months, her ALT enzymes returned to normal reference ranges, and her chronic fatigue resolved completely. Her liver successfully restored its normal function once we removed nightly metabolic stress. This outcome wasn't a miracle. It was the direct result of allowing her liver to perform its essential night shift. Now, let me share the simple bedtime recipe promised earlier, designed to combine these top ingredients into a single glass. I call this the Bedtime Liver Tonic, and it takes just 2 minutes to prepare. In a blender, combine 1 whole scrubbed kiwi, a 1/4 cup of blueberries, 1/4 of a ripe avocado for healthy fats and glutathione, half a cup of plain unsweetened kefir or Greek yogurt to support the gut-liver axis, a splash of water for consistency, and a dash of Ceylon cinnamon. Blend until completely smooth. That's all it takes. This drink is low in glycemic impact, rich in target antioxidants and fiber, and provides a satisfying evening alternative that actively supports your liver throughout the night. Drink it roughly 1 hour before sleep in place of late-night snacks that disrupt liver repair. Here are a few easy variations to keep your routine interesting. On evenings when you desire a sweeter profile, blend in a few red grapes or a spoonful of fresh pomegranate seeds. If you prefer a dairy-free version, substitute plain water for the kefir while keeping the blueberries and avocado. A simple bowl of sliced kiwi and blueberries topped with a spoonful of plain yogurt delivers similar benefits if you prefer not to use a blender. The key strategy is replacing refined late-night carbohydrates with whole liver-supporting fruits. Notice that grapefruit was intentionally excluded from the blended tonic recipe due to the medication interaction considerations discussed earlier. Keep grapefruit as an individual option, consumed only after receiving clearance from your doctor or pharmacist. Here is your clear 5-step evening routine to start tonight. First, establish an earlier kitchen closing time, making your final snack one of these targeted fruits rather than refined starches or sweets, so your liver enters its overnight shift in a fasting state. Second, select 1 fruit from tonight's list that you currently have at home and enjoy a modest portion about an hour before going to bed. Third, for maximum benefit, prepare the Bedtime Liver Tonic using kiwi, blueberries, avocado, plain kefir, and a pinch of cinnamon. Fourth, take a short 10-minute walk after dinner, which prompts your skeletal muscles to clear glucose from your bloodstream before it reaches the liver. Fifth, if you take daily prescription medications, ask your pharmacist this week whether grapefruit is safe to consume alongside your current prescriptions. That single question protects your safety while potentially unlocking one of the most effective liver-supportive fruits available. Now, eating the right fruit at night is half the picture. The other half is what you do first thing in the morning. Because there are a few ordinary morning habits, things you might be doing every single day with the best of intentions that quietly feed a fatty liver and undo the good work you did overnight.